The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Jerry Lala.
And I'm Dr. Richard Jensen.
And it's great to have you with us again. Freedom from back problems. Wow. They say about 80% of everybody walking the planet Earth has back problems at one or more times. And certainly as chiropractic physicians who are nutritionally oriented, we see a lot of people with back problems. And quite a few of them have been to chiropractors and osteopaths and physical therapists and massage therapists, and they've had all kinds of treatment. Many of them have had surgery and had different types of drugs that they've taken or been injected into their spines. So we see a lot of these folks, and they are taking a chance to see if there's something that we could do that maybe somebody else has missed. And so we're going to talk about that today, so that you, if you have never had a back problem, this will be a really good program for you. And if you are having back problems, this will be especially interesting. And we're going to start out by talking about scoliosis. Anytime that the spine, normally the spine is supposed to be straight, and we're going to look at that in a little bit, but anytime there's a sideways curving of the spine, either the right or the left, it's technically classified as a scoliosis. Now, there are many forms of scoliosis, and Dr. Jensen is going to start with a slide of a young boy, grade school child, who showing some postural alterations. So as you look at yourself in a mirror, or you look at somebody else from the back and from the side, you're going to be able to determine right off the bat if they have the normal curves in the spine, if they have, because we do have 3 normal curves in the spine when we look at it from the side, but when we look at it from the back, it's supposed to look straight. So Dr. Richard Jensen, are you ready to go?
Yes, sir, I am. Thank you, Dr. Lala. Let's bring up this slide of this young man, and as you can see here, this is a postural analysis of him. He's just standing naturally, and we're looking at him from 3 directions: from his back, from the side, and from the front. And so then by looking at this, you can see one is that if you look at him from the back, this is on the left-hand side of your screen, the line that bisects his body, so it's straight up and down his spine. So you can see there's a little bit of a tilt to his head that's going to the left, but then you see that the shoulders are tilted to the right, so they're lower on the right-hand side than on the left-hand side. It's the opposite of what it is to the head and neck. And then as you go down to the hips, which is the next line down, that's tilted the same way, just a little bit more. And then the tips of the fingers, you can see, are tilted the opposite way, basically the same way as the head. Or as the, yeah, as the, well, no, it's just tilted to the side because the one shoulder will be dropped lower than the other. If you look at it from the middle view, the side posture one, where you're looking at it, if you see the line that's in the middle of his ear, and it drops down to his shoulder, that's showing that he has a little bit of forward head carriage. And then from his shoulders down to his hips, his shoulders are further back than his hips, and his hips are further forward than his ankles. Now that line goes just ahead of the ankle there, so it's just a little bit far ahead from what your posture is supposed to be. If you draw a line, it's supposed to be a little bit ahead of the ankle. But as you can see, his pelvis is tipped way forward. And as you can see, the dip in his back and his low back, he's almost bent backwards there, and that's what we call a lordosis or a hyperlordosis. It's too great of a backward sway in his back, and as you can see, what happens to his posture is that his stomach hangs out a little bit more, which denotes weakness in the abdomen muscles, and a little bit too strong of pull from what we call the psoas muscles, which I'll show you what those are later. If we go to the front of him, you can see where he's got a low shoulder, and his hips are still turned towards the same side. And if you look at his knees, they're a little bit bow-legged, or not bow-legged, but knock-kneed from his posture. So we have a point that comes down in between, and then you look at his feet, and you can see where his feet on the bottom of the picture point inwards. Now, to let you know what this means is to look at the pelvis. The body has what we call righting reflexes. And righting reflexes show that, first of all, when we have our pelvis down here, that you can feel your hip bones here, and then your waist would come along here, and it goes on up to the shoulders and the head. This is the top of your leg. It's called the femur, and you have this muscle that I was talking about that's called the psoas muscle. Now, what we have is if a leg is shorter than the other, then it's going to tip the pelvis that way. Now, the thing is that this shortness doesn't have to be a physiological shortness. It doesn't mean that it grew shorter than the other. It's pure posture that could be creating this. If the toes are pointed out, or if they're pointed in, or if they're pointed just abnormally, it's asymmetrical from each other, so they're not pointing the same direction. One leg can become shorter than the other in relative to the other, and that's caused by muscular imbalance, such as if a toe is rotated in, that rotation goes all the way up into the hips, and that's dictated by this internal rotator of the psoas muscles, or the external rotator of the hip, which is called the piriformis. Interesting thing about that is the piriformis actually lays over this large nerve that people call the sciatic. So you can have a piriformis syndrome that causes sciatica in these people due to muscular imbalance. Now, the problem with this is when we looked at this boy from the side, he had an excessive sway in his low back. That excessive sway in the low back tells me that these muscles here are so tight that they're actually pulling this low back forward. The problem with that is that the nerves that come from here that go to the genital urinary area or perforate that muscle. They don't go around it, but they go through the muscle. And if the muscle is contracted that hard, he's not going to have optimal efficiency of these nerves going to that area, and therefore may have some problems such as bladder control that may occur later in life, or maybe now, who knows. The thing is that what you can do is help to relax these muscles and take that out. The other thing is that his abdomen would be weak because of that, allowing this to drop, and so therefore strengthening of the abdomen would also bring this back. And because these muscles on the front of his leg are pulling this down, they would be tight too. So for this particular person, you want to balance these muscles. And to find out which muscles to balance, postural analysis works very well with that. It also would show us where this person is predisposed towards pain later in his life. Somebody who has extra weight that carries it out in front of him like that will be predisposed towards having what we call a facet imbrication problem, where the posterior elements of the back are all jammed back here, causing a low back ache. And let's go on to, one of the things that I also wanted to show you is that if the pelvis is off a little bit, we have what's called righting reflexes in the body. And it's not, that, something happens and you automatically write a letter. It's more of like the righting reflexes to keep the eyes level with the horizon. So if you start out with your base going to one side, the spine, your righting reflexes here, will naturally make the spine bend back to straighten the eyes, but it normally overcompensates and then comes back the other way, and this is where you can get these S curves, normally just from trying to keep the eyes level with the horizon. So a problem down here can cause postural problems all the way up. And therefore, with correction and good spinal care, a practitioner who takes into consideration the muscular strengths and balances of that can also help with taking care of some long-lasting problems that can occur later in life. Dr. Lala, why don't you show us what normal posture is supposed to be?
Normal posture, well, we have a real good picture here that we're going to bring up for you now of this gentleman. And working from your left to your right, you'll see that we have a pendulum, a line that's bisecting his body. And normally when we look at a person from the front, their head should be straight, shoulders should be level, hips should be level, and knees should be in alignment. That pendulum should go from the nose right down through the symphysis pubis and be centered between the feet. When we look at the individual from the back, that being the center picture on your screen, again, we can see the earlobes, the level of the shoulders, the level of his scapula. You can see those, and then the level of his hips. And then we look at where his knee bends. We call that the posterior popliteal fossa, the back of the knees. And we can look at his feet. Are they straight, or are they turned in or turned out? Now, if we work our way back up in that center figure, we look at the size and shape of those Achilles tendons, the back of his ankles. Are they straight, or are they bowed like a bow and arrow string? And then we would look at those calf muscles. Are they of equal size and shape? Again, are the knees in alignment, or are they twisted in or out? And then we would look at the bottom of the individual's gluteal folds. That would be back there by his gym shorts. Are they level? Then looking up at the top, are his hips level? And then we would look at how straight the spine is. Is it side curved to either side as we go up the spine? How about the muscles? We can see the latissimus dorsi there, the sacrospinalis. We can see the upper, middle, and lower trapezius and the posterior cervical neck extensors. Are they all of equal size and shape, or are one side of the spine smaller and the other side larger? So if it's smaller, it could be atrophied. If it's larger, it could be what we call hypertrophied. So these are all important things to look at. They don't cost lots of money to look at those things. Now, when we look at this individual on your far right, we look at that pendulum, that line, see it bisects the ears, the center of the shoulder, center of the hips, the center of the knee, and down at the center of the foot. So that's pretty good alignment on this individual. What we know that is by God's design, we're supposed to have then a slight forward sway in the neck, a slight rounding in the mid-back, and a slight sway in the lower back. And of course, on this little boy that Dr. Jensen was talking about here earlier, and we'll bring that slide up right after this one, that we can see that that child is not developing correctly. So what it amounts to is that we can look at our posture, and if we begin to see any of these postural alterations, it tells us that something internally within the spine is abnormally changing the structural development of that individual. And being that your brain is like an electrical generator, your spine is like the switchboard of the nervous system. It houses and protects the spinal cord. And every organ, every tissue, even the smallest tissue in the body, has to have proper nerve supply and blood supply to it to function normally. Now, many times people won't see these postural alterations. They're not aware of them. And they grow up and they develop problems. So let's bring that little boy back up here again, and we'll talk about it now. As in Minnesota, and I know a lot of you people watch us in different states, and some of the other states do scoliosis screening generally in the summer before the children go back to school. And we do them all year long. We do a free scoliosis screening clinic, and we used to do it just in the month of May to get these kids ready to go back to school. But there are so many hundreds of these parents that call us, and they want us to do these scoliosis screenings, so we try to get them appointments for their children and to do it on a gratis basis. It doesn't take that long, and we examine the spine, we make postural pictures like this or digital pictures, and then give them to the parents so they have a record of it. And then, of course, it goes in the child's health record as well. But to have a child have postural alterations as minor as those are on that young boy in front of you is worse than letting a child who a dentist sees has a cavity and you choose, or that somebody chooses not to do anything about it. Because that tooth, if it continues to rot, is going to fall out and a new one will grow, or if it's a permanent tooth, it can be filled later on in life, and I'm not certainly encouraging that. But that spine and that posture and that nervous system isn't going to have that opportunity to be drilled and filled. And it is worse to let a child grow like that and go into adulthood, and you can bet, if I was a betting man, I can bet that that child more than likely is going to have health problems before he gets much older, and he's going to have worsening health problems later on in life. And there's no reason for that, absolutely no reason for it. But the key issue is that we get a good chiropractic postural analysis of these kids, at least by that age or even a little bit younger, and that we follow it along. And there's no need to take any x-rays of that spine if there hasn't been an injury, if there aren't any symptoms, or if we see very few postural alterations. Most of the postural alterations that we see in the clinic can be corrected with a few treatments often, and sometimes just with some simple exercises or getting some inserts made in the feet to correct that pronation problem that that little boy has. So let's go on now, and we'll take a look. Dr. Jensen's going to take a look at the feet of an adult now, the two-feet picture of an adult, number 166 it is, and we're going to see how, here we have this little boy with these pronated feet, and now we see an adult.
Well, what we see is a picture here with pronation of the feet. If you look at them, they're both tilted out, particularly the one on the left is tilted out to the side. And what this normally does is it shows that he would normally have a short leg on that one side with muscular deficiencies, probably causing that sciatic neuritis up there through a piriformis syndrome, where that one muscle that I talked about, the external rotator of the hip, is real tight. Also on that side, he will probably, just from seeing a multitude of these cases, with all probability, he will that the arch on that foot will fall, and causing that short leg, causing the knee to tip outwards, and therefore giving him knee pains on that one side. Now, that knee pain may not manifest immediately, but later on in life, because of every time he takes a step, the side of his knee is regarding forward walking. He's going to create stresses on the middle of that knee, and therefore start to generate knee problems later in life. The hip on that side many times has real tight psoas muscle. That's the one that comes from the front of the leg through to the back, causing some neurological problems on that side, which go down to the genital urinary area. And so you can talk about where these people sometimes will have incontinence and end up wearing a diaper later in life. They may have problems with prostate because it's not getting proper blood flow and neurological flow to that area. Many problems with the low back, with pain on the side, and that's generated on that one side, and then will, because of compensation to the other side, they will start to have problems on that side as well as because their base is off. It'll go right on up where people will start to have headaches and things, because, face it, on the spine is a train of joints, and the last joint is right here, and a lot of times they have headaches that start there and curve up over to the front, and those things can be corrected, one, through good set of orthotics which are specifically made for that individual, okay, through correction of both bony alignment correction and muscular correction. So it's one of those things where you want to analyze this individual and do the best you can for them in analyzing which exercises would be good for them to do at home or in the office, but this is correction for them to do at home to be a part of their own health care, to stave off problems that can come on down the road. Okay? To Dr. Lala.
Good. Thank you, Dr. Jensen. The next slide we're going to look at is this same individual who's, we're going to look at, the person was, in the previous picture, sitting, no weight bearing. Now the person is laying prone. And here we see the issue is even more easily to see, if we look at the left foot on the left side of your screen, we can actually, if we go up to the top, you can actually see where the Achilles tendons are bowed on both feet, both that left and right foot, and we can see how they're turned in. And you can actually see how more callus has been developing on those heels. And if we had the further up by the large toe, we would see some bunions up there. And again, the issue is, it is unbelievable to me, you can leave that slide up there, but I was in a tire repair and sales store here a few weeks ago, and a guy came in and he said that his front end was kind of vibrating. He wanted him to take a look at it. And they looked at it, and the guy said, hey, your front end is out of alignment, and I think your tires need to be balanced. And the guy, I forget what it was a real minimal charge, and the guy said, I don't want to do anything about it. And it was a pretty nice car yet, too. You know, it wasn't some old junker that maybe isn't worth investing in. And the guy wouldn't do it. And it's no different than I've run into patients, not many, thank God, who you'll show them these kind of postural defects and show how it's affecting their back and how it's affecting chronic back problems. They won't have inserts made for their shoes. And it is just absolutely incredible, just as much as if you have a child like we've been looking at here, and you see those postural problems in their feet, and some correct inserts aren't made. And let me tell you, if they have, you can bring up the next slide now, please. If they have these postural alterations, these children, I'm not talking about babies now, they should not have treatment without a front and side views of that spine. Weight-bearing x-rays, all right, that they're standing weight-bearing. They should not. I mean, these kids are our most important assets. And I see people take money and use it in all kinds of strange different places and not invest it in children's spines and their health that way. Well, the next slide that we have here is we see the individual. If we can go back to the slide of those two individuals that were up there, I'd appreciate it. That we had those two men, and when we look at their feet, we see that one on the far left, that his foot is toeing out. So that's a pronation issue, but the one in the darker shirt on the right, that foot is relatively straight. So he's going to have less problems in his knees, in his feet, in his spine than the person on the left. And again, the issue is getting the proper inserts into the feet, and these inserts should be made with weight-bearing impressions. This is not an issue where you can go to Kmart and figure out what kind of glasses you should wear. This is something that should be done very specifically to the individual, not just something where you walk in a shoe store or on the internet and get a pair of these things. Don't waste your money and your time. Now we'll go to the next slide, please. Now the next slide is a good example of this pronation issue. To avoid excessive pronating or turning out of the feet, set your foot down on the outer edge when taking a step forward. Well, that individual is already pronated. And so we want to get the proper correction inside of the shoe to stop that pronation issue. So now they're going to bring up the next slide, and Dr. Jensen is going to give you some real good illustrations of the normal feet and abnormal alignment of feet.
If you look at this picture, the top left-hand corner, you see where the feet flare out during the gait. If you look at those feet, they don't show any arch in the middle, and that's what tends to happen. Is through the pronation, it allows that ankle to settle down so that the arch is no longer there. And of course, you can look at that from when a person is standing up. You take your fingers and put them underneath there. They should have some room for the tip of that finger to be able to go under up to approximately the first knuckle on that finger at least, for an arch to be there while they're standing. What happens is you have a bone called the navicular that's in the foot, and that's basically on top of like a hammock of plantar fascia, which is just some connective tissue between the front and the back of the foot. And many times what happens is they're stretching that plantar fascia to allow that navicular to fall down towards the floor. Now if you go to the middle top, you can see where this person has no arches there, when they're standing, their Achilles tendon will be bowed inwards because because of the foot's position on the floor. If you keep your feet like that and you're wearing your shoes like that, then if you see the middle bottom, those shoes will have excessive wear where you were striking the floor with them. And what happens is, after a while, if you don't have corrective orthotics in there, you are generating your own incorrect orthotic on the bottom of your shoe, exacerbating the problem that is occurring. See, because this is making the heel tip out, which is a supination of the heel, and where the toes are flaring out, it's a supination of the forefoot. That's one of the things that you find is the back foot and the forefoot have opposite corrections that need to be made. Okay, so going from the excessive wear in the shoe actually creating a bad orthotic for you, that's one of the reasons why it's good to get new shoes, because you wear them into your problem areas. There is internal, actually that should be external knee rotation that's occurring there, because as the toes point out, the knees follow that. And what happens is the medial collateral ligament that's on the inside of the knee will start getting stretched, and when you stretch a tendon, tendons are highly innervated for pain and can cause pain and disrelationship of those knees and uneven wear inside the knees, therefore later in life causing what we call osteoarthritis of the knees. And that's something that can be avoided, especially the earlier that you find it, the better your posture is going to be and the less you're going to wear out. Dr. Lala?
Well, the next slide that we have is an outline, an illustration of the spine, looking at it from the back. And we see that we have 7 cervical vertebrae in the neck. Looking at the right side of the screen now, the neck, those are 7 cervical vertebrae. We have 12 thoracic or dorsal vertebrae in the mid-back. We have 5 lumbar vertebrae in the lower back, and then we have 2 iliac bones and a sacrum bone that's wedged between the 2 ilium bones, and of course attached to the sacrum are the coccygeal segments. And of course, see here we see the hips are level and the spine is growing nice and straight. It's growing nice and straight, just exactly the way it should. Now inside of that spine, Dr. Jensen is going to take a look at your nervous system now on the next slide.
Inside of that spine is a spinal cord, and out through holes that are between each of the vertebrae, those are called the intervertebral foramina, which is another name for a hole or a tunnel, passes through nerves. Now each of those nerves go to specific organs in the body, and so you can see from different sections there, you'll see those yellow lines going towards particular major organs. Now the blue lines are the cranial nerves, which help with the function as well, and there's a regulation between the head and the rest of the spinal cord of the regulation of these nerves, and you can see that they affect not only the facial functions or organs, but through the heart and the lungs, through the stomach, the pancreas, the intestines, all the way down through the genital urinary section. Dr. Lala?
Well, we've only scratched the surface with reference to spine and spinal problems. Take care of your spine, would you? A healthy spine is a precursor to a healthy body. It really is. And if you have chronic back problems and nobody's really taken a serious look at your feet, or if they haven't taken a serious look at your spine and made some new and up-to-date x-rays, do that. Really take care of yourself. It's a worthwhile investment.
The Fellowship of the Great Physician, through its School of Health and Healing, provides classes each Thursday evening. The primary focus of these classes is biblically based spiritual health and healing, with a brief teaching on physical health and healing. There is no charge or registration fee for these classes, but a free will offering is received. For further information on the School of Health and Healing, class time and location, or the topics discussed on today's program, contact us at the Fellowship of the Great Physician in care of Dr. Lala or Dr. Jensen at 200 Village Center Drive, Suite 100, North Oaks, Minnesota, 55127, or or telephone us at 651-484-8521. Thank you for joining us today.